10 million deaths per year. That will be the estimated impact of antibiotic resistance in 2050. To try to combat this, the MSF Foundation has developed an open-source application which sets out to improve access to patient diagnoses and alter outcomes. The name of this free app? Antibiogo. So what are we really talking about here? Well, antibiotic resistance can affect anybody in any country, but countries with limited resources are the most concerned. This is because they lack access to reliable diagnoses of bacterial diseases, and the MSF Foundation has observed that this is the case in most of the countries where MSF operates. For example, in Haiti and Yemen, as places with ongoing active conflict, MSF sees patients who have suffered severe traumas. They frequently develop acute infections, and we see high rates of antibiotic resistance. Elsewhere, in sub-Saharan Africa, MSF teams treat significant numbers of children under 5 suffering with sepsis and meningitis who don't tend to respond to prescribed antibiotics. For these types of patients, an antibiogram is needed. This is where bacteriological, blood or bone samples would be taken in order to establish the right type of antibiotic medication. However, there's a notable lack of laboratories and microbiologists available to perform and interpret the results, and this, in turn, leads to a lack of appropriate treatment for patients facing life-threatening conditions. To address this problem, the MSF Foundation created Antibiogo. Antibiogo is the first diagnostic aid application for smartphones designed to combat antibiotic resistance. It's been developed through the use of artificial intelligence, or AI. This AI requires no network in order to operate, nor an in-depth knowledge of microbiology. So, all that's needed is to upload a simple photo of an antibiogram, and the application will assess hundreds of existing rules of interpretation to provide a high-quality diagnosis. The app is the result of a collective endeavour. The MSF Foundation brought microbiologists and engineers together, taking a multidisciplinary approach in conjunction with I2A, Google.org, the Laboratoire de Mathématiques et Modélisation d'Evry, EPFL, and Paris-Saclay University. In 2019, Antibiogo was selected by Google.org's Artificial Intelligence Global Impact Challenge, benefiting from a $1.5 million grant and dedicated development engineers. After 3 years of collaboration, this certified medical device can be easily deployed at a large scale and utilised in low-income settings. Today, at the MSF Foundation, we're convinced that Antibiogo can help save lives by guaranteeing improved access to a correct diagnosis in the places where it's needed the most.